année, dans le cadre de mon mandat, je présente un rapport annuel sur l'état de la santé publique au Canada. Cette année, nous nous trouvons à un moment critique. Nous continuerons de lutter contre la pandémie et nous nous tournons également vers le rétablissement. Dans mon rapport, je reviens sur la gestion de la pandémie au Canada et je propose des mesures clés pour renforcer notre système de santé publique et faire en sorte que nous soyons mieux outillés pour l'avenir. I often say that as Canada's Chief Public Health Officer, the population is my patient. Instead of taking care of individual patients, public health is concerned about the population's health as a whole. Its mission is to prevent injury and illness, promote healthy behaviors, and to ensure that all people have an equal opportunity to stay healthy and well. La santé publique, c'est l'éclosion qui n'a pas eu lieu, le traumatisme qui n'est pas arrivé, et la surdose d'opioïdes qui a été évitée. COVID-19 has been a stress test for Canada's public health system. Over the course of the past 2 years, we have witnessed our public health system switch into overdrive as it rapidly adapted to meet the challenge of protecting our health during a global pandemic. And incredibly, it rose to the occasion, but at a serious cost. Our public health system has been stretched dangerously thin, and it is in need of critical reinforcements. Comme nous l'a rappelé l'émergence du variant Omicron, la santé publique doit être prête et capable de réagir à tout moment lorsque de nouvelles menaces pour notre santé surviennent. The call for public health renewal in Canada is not new. It has been echoed by many others in the field over the years, including past chief public health officers in annual reports dating back to 2008. Toutefois, la pandémie de COVID-19 a servi de signal d'alarme important. The COVID-19 pandemic has served as an important wake-up call. Simply put, we were not prepared to face a public health emergency of the magnitude of COVID-19. We can no longer dismiss the voices or delay necessary actions. There are increasingly urgent signs that we need to act now. As I discussed in last year's annual report, From Risk to Resilience, an equity approach to COVID-19, people in Canada were not on an equal footing when the pandemic took hold. Broader inequities in our society, including colonialism, racism, and other forms of discrimination and stigma, have resulted in disproportional impacts of COVID-19 on the health of some populations in Canada. Cette année, la lutte contre la pandémie devient la priorité absolue du Canada. Mais d'autres défis complexes en matière de santé publique nécessitent également une attention urgente. Il s'agit notamment des effets des changements climatiques sur la santé, de la crise des surdoses d'opioïdes, de la résistance aux antimicrobiennes et de la dégradation de la santé mentale. We know that the same people who felt the impacts of COVID-19 more severely will also be those harder hit by other health crises. We must take action to ensure that everyone in Canada is equally protected and able to achieve their optimal health moving forward. Canada's best defense against future public health threats is a strong public health system and a healthier population. Dans mon rapport, je décris 4 domaines d'action prioritaires visant à stimuler la transformation du système de la santé publique. First, we must renew and reinvigorate our public health workforce. The pandemic has seriously impacted public health workers across the country, with frequent reports of burnout. Après près de 2 ans de lutte contre la COVID-19, beaucoup de travailleurs en santé publique sont épuisés, mais heureusement, la pandémie a aussi suscité un intérêt accru dans le domaine de la santé publique. We must work to recruit, retain, and build the next generation of public health professionals with a highly skilled, diverse, and inclusive workforce that best reflects the communities they serve. Surge capacity is also required to rapidly expand the workforce in times of emergency. Second, our public health toolbox needs some serious upgrades. Il ne fait aucun doute que nos efforts de lutte contre la pandémie ont été influencés en partie par des lacunes importantes dans nos systèmes de surveillance et de données en santé publique, y compris un manque de données sur la race et l'origine ethnique et un manque de données comparables entre les provinces et les territoires et des lacunes en matière d'information à l'échelle locale. Working across federal, provincial, and territorial governments, a pan-Canadian health data strategy is underway to address these gaps in a secure and ethical manner. However, its timelines must be accelerated to ensure that public health has the right data at the right time for effective decision-making. We also need to strengthen a Made in Canada research agenda in order to identify which public health interventions are most effective to improve the health of populations and reduce health inequalities. Troisièmement, nous devrons moderniser nos modèles de gouvernance et nos structures de collaboration. The pandemic has demonstrated once and for all that we cannot work in silos and that complex public health challenges require a whole of society approach, working together across jurisdictions, sectors, industries, communities, and borders. We must ensure that these efforts are better supported with collective action based on clear and measurable indicators to understand if we are meeting our goals of achieving better health for all. Les collectivités des Premières Nations, des Inuits et des Métis doivent également être soutenues dans l'élaboration de leurs propres priorités, plans et solutions en matière de santé publique. Enfin, des investissements appropriés sont essentiels pour permettre l'amélioration de nos effectifs, nos outils et notre gouvernance. As we have seen in the past, public health resources are often scaled back after public health emergencies as governments move to address other priorities. This is referred to as the boom and bust cycle of public health spending. Ceci désavantage le système de santé publique au début de chaque crise, puisqu'il n'a pas la capacité ou les réseaux nécessaires pour une intervention rapide. Il a également une incidence sur la capacité de la santé publique en général, car des objectifs, soit la prévention des maladies et de la promotion de la santé, se mesurent à plus longue échéance. My hope is that the recommendations outlined in my report spark a much-needed national dialogue and catalyze collective action on public health renewal. However, key to this will be a fundamental shift in the way we think about health and value health in our country. An effective health system is more than treating illness through medicines and hospital procedures. It means preventing these illnesses from happening in the first place. En fait, la santé publique et notre système de soins de santé sont complémentaires. En gardant les gens en santé, la santé publique réduit le fardeau de notre système de soins de santé et contribue à sa durabilité. As people of Canada, we value our healthcare system. It is built in the social fabric of our country. We must come to value prevention and wellness to the same extent that we do medical treatments and care. I would like to conclude on a positive but pragmatic note. Canada's public health system is not perfect, and significant work lies ahead in terms of our transformation process. We must get ready to roll our sleeves up. But I've always had great hope and confidence in our system's vast potential, and I know that many of my counterparts at provincial and municipal levels are equally optimistic. Cela m'inspire encore plus. However, to fully realize our vision of a world-class public health system, we must all be invested. The public's health is a responsibility that we all share. We have seen examples of greatness throughout the pandemic. including the largest mass vaccination campaign in Canadian history, which mobilized many sectors and individuals to great success. Indigenous ownership within the pandemic response, and innovative local efforts to help community members in need. This is just a glimpse into what is possible when we all work together. Public health is for everyone, by everyone. Joining forces across communities, governments, sectors, and internationally, we can build a public health system that best serves us all and supports a healthy and thriving society. It is in working together that we can make sure we get it right. C'est en travaillant ensemble que nous pouvons nous assurer de bien faire les choses. Thank you. Merci. Make rich.
Thank you.
Happy to take questions.
So just before we take questions, Dr. Tam, your feed is lagging quite a bit. So I've been told that it may be because of your artificial background, so it complicates the task of the interpreters, but we'll just continue like this, and if the lag continues, I'll just ask you to turn it off.
Okay, thank you.
Operateur.
Thank you, merci. You may press star 1 at this time if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Dylan Robertson from the Winnipeg Free Press. Please go ahead.
Hi, Dr. Tam. Thanks for taking our question. Your report mentions throughout the need for consistent funding for public health, but from what I read, you're not advocating for a separate transfer or a change to the Canada Health Act. So can you please explain why you aren't making those specific recommendations?
Yes, I think as one can appreciate, there are bigger policy discussions that need to be had. This report stimulates those discussions. There are different policy options for decision makers in terms of how to sustain that funding for public health. I'm also not just saying that we must just ask for more resources. What I'm advocating is a better definition of the public health mandate so that everyone understands what we're being asked to deliver on. Have frameworks and indicators aligned to common national level priorities and objectives, and be funded sufficiently on an ongoing basis, sustain some of our very critical foundations. And so I think that is, I would hope that this report supports some of the discussions taking place, I'm sure, in the very near future on the Canada Health transfers and the funding for provinces. But I would be very happy to contribute to those discussions as our political decision makers undertake those in the days and weeks and months to come.
Opérateur, juste un petit instant. So, Madame Tam, unfortunately, I'm just going to ask you to, yes, I'm just going to ask you to take out your artificial background because the lag is continuing. So.
Okay, this will help.
Thank you.
Okay, let's see how that goes.
Question.
Yes.
Hopefully it'll work.
For a follow-up question, Dr. Tam, I'd like to know about, I'd like to ask about COVID rapid tests and inconsistencies in how provinces are rolling these out. We know that in some provinces, rapid tests are widely available. In others, like BC and Manitoba, the vast majority of people have never seen a rapid test. I know that epidemiology is always local, but I'm wondering what you make of that inconsistency and if you have any concerns about jurisdictions that have tests, but they're not actually being widely used.
Well, I think to combat something as complex and as wide-reaching as the pandemic of COVID-19, we need to use everything we have available to add those layers of protection, of which rapid test is one. So I think from the federal level, you can appreciate that support has been provided in supplying the rapid test. But it's very difficult for the federal government, who isn't working on the ground, to figure out where those rapid tests are best utilized. So what I'm trying to do together with the Chief Medical Officer is discuss best practices and provide guidance in how rapid tests are used. But it is up to local jurisdictions. So I talk about governance quite a bit in my report. It is important for us to look at how this share responsibility for public health work in our federal, provincial, and territorial context, in our federated context. It is not easy, but I think the role of the federal public health agency is to provide the technical support needed and to share best practices as we have it. So I can't answer your question directly, but I think through those kind of influences, the supplies, the financial and other resource supports, we're hoping that communities all get access to the tools that they need.
Prochaine question.
Thank you, merci. La prochaine question de Catherine Lévesque, la presse canadienne. La parole est à vous.
Oui, merci beaucoup. Bonjour, Dr. Tam, Dr. New. Écoutez, je voulais vous un peu revenir sur ces demandes de votre rapport et savoir, est-ce qu'il y a un chiffre qui est estimé par rapport aux investissements là, qui devraient être dus en termes de transferts fédéraux en santé? Est-ce qu'il y a un chiffre là, que vous aimeriez voir de la part du gouvernement fédéral pour justement atteindre les objectifs dans votre rapport?
Mon rapport, j'ai déjà dit que des investissements appropriés sont essentiels pour améliorer nos objectifs, nos utiles, notre gouvernance. Maintenant, il n'y a pas un bon chiffre pour les investissements dans le domaine de la santé publique. Mais selon les données probantes, environ 6% d'investissement dans le domaine de santé est approprié pour la santé publique. Est-ce que c'est suffisant? C'est une question pour notre leadership pour discuter. Mais j'aimerais que mon rapport stimule cette discussion dans les prochains mois, pendant la discussion pour les investissements fédéraux, le transfert d'investissements pour le domaine de la santé publique. I think what I'm trying to do is to really stimulate a national shift in our thinking about health. My ambition is to build a future where public health is viewed as central to our daily lives, so that public health is as invested in an appropriate way as our healthcare system is as well, and working in complementary ways to healthcare. But is 6% investment in public health, and that's not equal across Canada. Some public health sectors across our country at the local and provincial levels, even less than 6% of the healthcare spending of the global federal transfer as well. So is that enough? It's not enough if you think about the fact that keeping our population healthy is as important as it is for treatment.
C'est Dr. New. Peut-être je peux aussi souligner quelques points que Dr. Tam a déjà constatés. C'est vraiment important de reconnaître que le système de santé publique, c'est un peu différent que le système de soins de santé. Les deux sont essentiels, ils sont bien liés, c'est important aussi d'intégrer. Et c'est plus le principe de reconnaître l'importance du système de santé publique par rapport aussi au système de soins de santé. Si on a beaucoup des blessures, c'est évident pour tout le monde. Oui, OK, peut-être il faut voir plus de médecins pour guérir les blessures, mais pour la santé publique, c'est toujours un défi parce que comment on peut montrer les résultats? C'est la prévention, la promotion de la santé. Comment on peut montrer combien de maladies on a réussi à prévenir. Donc, ça c'est les défis pour la santé publique et je pense que Dr. Tam veut vraiment, comme dit, commencer les discussions, les bonnes réflexions de tout le monde, les leaderships aussi, nos autorités, et, comme il dit, les ministres élus. Merci.
Oui, on a besoin des investissements durables aussi. Parce que maintenant, on a dit de boom and bust cycle, c'est comme les dents de scie. Up and down like this. C'est pas une bonne stratégie.
Merci pour la précision entre les soins de santé. J'avais une petite bulle au cerveau. Je voulais, dans cette perspective-là, quelles sont vos demandes spécifiquement pour l'Agence de la santé publique du Canada? Est-ce que, encore une fois, vous avez un chiffre en tête ou vous avez besoin de quelle sorte de budget justement pour réaliser les objectifs dans votre rapport?
Oui, je veux dire qu'il y aura les autres reviews, les autres études pour notre réponse durant cette pandémie de COVID-19. Mais comme les autres organismes dans le système de la santé publique, nous sommes impactés par le même cycle d'investissement de boom and bust dans le C. Ce n'est pas vraiment une bonne stratégie pour notre agence non plus. Durant cette pandémie, on a beaucoup de ressources pour la réponse. Mais le plus important, selon moi, est le rétablissement équitable pour la population. Et on a besoin de ressources dans notre agence pour assurer que le rétablissement après la pandémie soit équitable. Donc, ce n'est pas pour moi pour indiquer quel niveau on a besoin des investissements, but I think there will be other reviews of the Public Health Agency. All I can say is that we have a lot of capacity that's invested, but they are very short term. And so people who've come to work with us, who've supported us throughout this time, is a short-term response. And what we need is a sustained investment at the right size with the right surge capacity. But we cannot handle this sort of dip in resources just before the next crisis.
Prochaine question.
Next question. The next question is from Mackenzie Gray from CTV News. Please go ahead.
Hi, Dr. Tam. 21% of cases in Ontario are now Omicron. So can you definitively say that there's now a community transmission of Omicron in Canada?
Yes, there is community transmission of Omicron variant in Canada. We've learned a lot about this variant even in the last days. We have learned that it is a highly transmissible, or certainly have a great spread potential, this virus. It's probably very transmissible, but there's also a contribution from either waning immunity from the natural infection, and also there's an impact on the vaccine protection from at least the antibodies as well. So what we're seeing in Ontario, I expect to be seen in other areas of the country, as has been seen in Europe and other areas of the world. But for sure, we are seeing community transmission, possibly in its early stages, but this can rapidly escalate in the days to come.
I just want to read you a quote that Peter Uni said this morning from the Ontario Science Table. He said, "This will reach every single person," speaking about the Omicron variant. "Statistically speaking, there will be very few lucky ones. Considering how few people in the population have booster shots, how slow the provinces are giving booster shots out now, and the quick rise we've seen in cases recently, is it fair to say in the coming weeks that we could reach that 12,000 mark that you would put out in your modeling on Friday in short order?"
Yeah, thank you for the question. So I think we are mounting the booster vaccination right now, and the National Advisory Committee on Immunization will meet once again just to look at whether there's any adjustments to the recommendation. But I think along the lines of what they've already recommended, those who are over the age of 50, particularly the oldest age groups, those in higher risk settings, whether they be long-term care or congregate living, or Indigenous peoples from Indigenous communities, healthcare workers, all need to get their booster shots. And based on my discussions with Chief Medical Officers for Health, including Ontario, there will be a significant effort to ensure that that age group and those high-risk groups get their booster doses as quickly as possible. So my message to all Canadians is please follow that public health advice and get your booster shots. And actually is equally, if not more important for those who haven't had the vaccine to also get their first and second doses, including the younger children. And that is very important to do. But vaccines take time to, of course, take effect. And in that period of time, the virus can transmit rapidly and spread rapidly amongst populations. So our other message, as usual, is to observe public health measures and reduce those contacts while the vaccine program is escalating.
Prochaine question.
The next question is from Jamie Murashi from Global News. Please go ahead.
Hi, everybody. Thank you so much for taking my question today. So I think this might have been touched on in French, but I'll just get you to elaborate a little bit. So you said that the issues that you discussed in the report have been around since 2008, perhaps even longer. So what makes you think that you can make these changes now, in a time when we really do need to make them?
Thank you so much for that question. It is the eternal struggle for public health, which is more about prevention, health promotion, preparedness than it is as much as it is about health protection and emergency response. The difficulties for making the case for public health is that our outcome and our indicators is things that don't happen. It's injuries that don't happen. It's vaccine preventable diseases that don't happen. So it's very difficult to communicate those kind of indicators, the counterfactuals in terms of what we were able to prevent. So that's been quite difficult for the public and perhaps for decision makers to understand. The other thing is that public health always deals with very complex issues that take quite a long time to tackle. And as a result, they often span the duration of political election cycles. We need to think a longer term. So investing in public health is about that longer duration and sustained effort. I do think Canadians are passionate about the healthcare system, and we know that it's also stretched. But if we don't go further upstream, as we call it in the report, and prevent people from essentially falling into the river in the first place, and then trying to hand people a life jacket at the other end, then we will never be able to sustain the kind of investments in our health systems. So really, public health is there to also protect the healthcare system, as we've seen in this pandemic. So my message is we always have to keep going back to our decision makers to make this point. But this is such a critical period because the pandemic has really shown everyone how the public health system is there to protect the healthcare system and is there to stimulate the longer investments, not only in the health sector, in the social, economic, and other sectors, so that we can be healthier. What I said in my remarks, what is our best defense against future public health threats is both a strong public health system and a healthier population. So that's what it's about. But it's very difficult to make your case when everyone is very focused on the immediate.
Okay, so what happens then if we don't make these changes? History suggests that we are sluggish and we don't pursue what's in these reports. So what's the outcome then?
So the outcome is, not only is that we got to focus, of course, on finishing our response to this pandemic. Very important. But even before we recover from this pandemic, another health crisis could come along simultaneously. And let us not forget, we already have a very significant simultaneous crisis in terms of the toxicity in the drug supply and the opioids and other substance use related toxicity deaths. That is a simultaneous event, and that is falling behind. So without further investments, we will not be able to tackle the health impacts of climate change, antimicrobial resistance, mental health issues. So our population will fall behind in terms of our healthy life years gained. So those are the consequences. And just like climate change, it takes a whole of society response. Anything to do with a public health challenge takes that whole of society complex response. So really the end result is that we won't be as healthy as we could be. Some of our populations will again be impacted again and again and again. Same populations, the ones that are experiencing health inequities, every time a public health challenge comes along, they'll be impacted further and further, and then therefore increasing the health disparities amongst the population. And that never amounts to good health, because we're always safer when everybody's safe. We're always healthier when other people are healthier, as has been demonstrated during this pandemic.
Prochaine question.
Next question.
The next question is from Carly Weeks from the Globe and Mail. Please go ahead.
Hi, and thanks for taking my call. My question. I wanted to ask you again about rapid tests. You had mentioned that there are some best practices that you've been discussing. I was wondering if you might be able to elaborate a little bit on what some of those best practices are. For instance, how these tests should be used, what's the right setting, because we have seen some medical officers of health come out and question the validity of these tests or whether they should be used at all. So I'd love your thoughts.
Yes, I do think that they're very helpful, especially under certain circumstances. So rapid tests are there to help achieve a number of objectives. Some of the most urgent use of rapid tests pertains to when there is an outbreak and an escalation in cases in your community. For example, if the Omicron virus is spreading in your community, you would be able to apply those rapid tests. We're still, of course, looking at how well those rapid tests are performing against the Omicron variant, but so far so good. So you can use those rapid tests quickly to gain a sense of what are the edges of this outbreak, how many people might be involved, but also as a preventive measure to essentially manage that kind of outbreak. You can use rapid tests as part of screening for high-risk settings, whether they be high-risk work settings, long-term care, healthcare workers. Those are very important. We've seen how rapid tests can help more remote and isolated communities as well. Point of care testing, because it's very difficult sending tests for PCR testing to larger laboratories. So providing rapid tests to those areas of need are very important. Some of our rapid tests, I think, have been deployed to underserved communities, homeless shelters and other places, and with the support of the Red Cross. Those are very important as well. Then on top of that, I think where people are debating is more, how do you use them in workplaces, and how do you perhaps leverage them for school kids? We want kids to stay in school. And if there is a case in a school, how do you use rapid tests under those circumstances to not dismiss the whole class for a long time? So applying rapid tests under those circumstances can help keep kids at school, keep certain workplaces from going. So I think those are some of the really key practices that people are learning. But the other thing that we're learning is that under circumstances of low prevalence or low caseload, you actually have to test a lot of people to find a single positive. And so that means we do still have to be prudent in using these rapid tests in the most appropriate way at the right time for the right populations.
Thank you for that. We're also speaking about the new variant, of course, and how it's very quickly overtaking things. A lot of people feeling very worried and maybe a bit hopeless as well. We're sort of 2 years into this. I guess what I'm wondering is if you can paint a bit of a picture of how we can combat the rise in new cases, and whether or not you think that, right now, are we doing enough to combat it? How do we avoid things like going into a lockdown or school closures? Can we avoid those things in the days and weeks and months ahead?
Yeah, so the really incredible thing I think I've witnessed throughout this pandemic, and certainly for at the moment of emergence of this variant, is that scientific information is shared very rapidly. Thank you to our South African colleagues and the United Kingdom and other countries experiencing this rise just ahead of us. So we are learning something every day very rapidly. And we are learning about the rapid growth rates of this virus. We're a little bit, as I said, a few days maybe or a week behind the European countries. So we can learn a lot by acting rapidly at this moment to try and reduce our contact rates and reduce spread. We know those things work. At the same time, I'm also grateful for the fact that it's been a year since we first launched, practically a year, almost the 1 year anniversary of the first implementation of the vaccine programs. And we've been served very well. And thank you for Canadians for rolling out their sleeves. We have achieved a very high vaccination coverage over time compared to other countries. And so here we are again, asking people to roll up their sleeves for those booster shots, particularly for the more higher risk populations. That's what we need to focus to do. But you need both vaccines and reduced contact rates right now to dampen the effect of this virus. So again, much as I said, almost at the beginning of the pandemic, you're trying to avoid that very sharp peak in cases, because that will inundate your healthcare system, even if the severity is milder. There could be enough transmission that hospitals can be overflowing. So what you want to flatten that curve so that it comes under the ability for the capacity of the hospital systems to manage. And I think we learned over time, if we don't act fast, then you begin to lose the ability for us to manage things. So this isn't any different from any other time, but I would stress that we think vaccines can still be very effective against the severe outcomes. The vaccine effectiveness against infection is generally lower than the vaccine effectiveness against severe illness. So I'm still very hopeful, and I ask everybody to continue to contribute to this effort as we are moving into the next weeks.
Next question.
The next question is from Ryan Tumulty from the National Post. Please go ahead.
Yeah, good afternoon, Dr. Tam. You talk in the report about a pan-Canadian data strategy. I know this has been tried before. It was tried after the AIDS epidemic in the 90s. It was tried after SARS. And a lot of money has gone into these efforts and not produced a functioning system. I guess I'm wondering what you feel will change this time, what needs to change to make that happen, and given that provinces still have the authority constitutionally over healthcare, if you think you can bring them together to work on a national system like this.
Thank you so much for that question. It is a point of frustration for those of us who've been in public health for a long time. We all believe that good data that is timely, complete, and comprehensive in terms of the coverage that is needed to link the health data to the lab data, to the clinical data, to the social and economic indicators that helps us to target our policies are very, very important. But you, I think, hit the nail on the head, is that governance needs to be looked at. Data governance is very important because we live in this federated system. Everybody, and I would say every individual, should be able to actually recognize how that data is helpful to them as an individual in our country and its populations and communities. I think highlighting that, I think the public actually expects that, in fact, the information collected is being used. I think they'll be a bit astounded to find that there are these barriers. So I think what I'm advocating for is that we build on some of the gains that we've had during this pandemic. We need to consolidate those gains and not let it slip backwards. For example, Through the Pan-Canadian Health Data Strategy, we actually had short-term objectives to rapidly collect data and case-based data, including race, indigeneity, and other essential elements as a short-term rapid approach. We have made some gains in those areas. Not totally, but we did make some gains. And that can be consolidated at the same time as looking at the longer-term strategy, which is being laid out and being informed by a expert advisory group headed by Dr. Vivek Goel, and you will find those reports available. In those reports, it provides some recommendations on governance. And governance is so important because the structures necessary and collaborative structures to monitor, sustain, and evolve the strategy is very important. Trust in the structures and particularly from First Nations, Inuit, and Métis peoples are very important. Policies on models of data stewardship. Dr. Goel had emphasized that in his external advisory group, it's about stewardship more than it is about custodianship. We must let those data be appropriately utilized by all who need to utilize it. Interoperability. So I think with the advent of new information systems, we have the tools to the effect that not every jurisdiction has to have the exact same IT platforms, but it's the interoperability that must be addressed through principal standards of design. I think we can do that. The capacity and the literacy is very important in terms of terminologies that we need to adopt. The literacy in what health data is needs to be prioritized. So there is, in fact, a number of concrete recommendations that I think we should take into account. And the Public Health Agency is working together with the province and territories and our healthcare data providers to try and make this work. All I can say is we just got to give it a really good go yet again. But the opportunity is in front of us because we can solidify the gains that we've had during the pandemic. And there are other gains in data, such as the Vaccine Connect system and others that we can now build on.
It's Dr. New. Maybe I could just add a final point to what Dr. Tam is laid out. You know, obviously, as we move forward, you know, there's things that we could look at, IT infrastructure and so on. But at the end of the day, I think we need a culture shift. And if it takes a once-in-a-century pandemic to harness and leverage what I would call political will to make the changes necessary, that's really, I think, at the end of the day, what we're looking at. So I think everyone understands what's happened during this pandemic. Yet again, it's reinforced all of the weaknesses, vulnerabilities, et cetera, as you mentioned in our sort of Pan-Canadian data strategy. And I think as we move forward, it's a culture shift. It's also, I think, a matter of political will. Thank you.
Prochaine question.
Next question.
Est-ce qu'on a d'autres questions?
Mention of it.
Further questions?
I'm sorry.
Oh, go ahead, Ryan, with your follow-up. Sorry.
Yeah. So the other question I had about the report was you mentioned a little bit, you talked a little bit in the report about GFIN and the need for surveillance, as well as, again, just very little bit, you talk about the need for securing borders when it comes to disease. I'm wondering, you know, do you see a big role for international surveillance like GFIN, and do you see an overhaul or a need for an overhaul of how we screen for disease in airports and borders and things like that?
Yeah, so I'll first tackle the early warning systems and what we call event-based surveillance. So that is important, and GFIN is one of the systems around the world. But what you highlighted is very important. We need to have all these systems connect and connect with the WHO. They've just essentially established a hub for pandemic and epidemic intelligence in Berlin, supported by the German government as well. And so we need to hook up to that infrastructure, because really you need very rapid sharing of intelligence across the globe. But once you have that intelligence, you then need to have the proper analysis in order to affect action. So building the analytical capacity is very vital on the risk assessments. And then the foresighting. So I've been saying that we can't look backwards at data, particularly at information that's evolving so rapidly. You need to forecast and project. I think we've learned a lot during this pandemic, and you've seen some of the modeling and projections, not only from the public health agency, but by the provinces. We've got a massive network of academic and other mathematical and modeling expertise, genomics modeling. All of this has been invested in during this pandemic. Again, I would like to be able to say that we can consolidate those gains and build upon them for the next round. And so it's an integrated approach to risk assessment. We've now, in follow-up to some of the reviews of GFIN and the initial risk assessment, we've already strengthened an integrated risk assessment hub inside the agency that will connect to the global hub and spoke kind of model, and then be able to project as well as review the data that we have in front of us. In the area of the borders, that is actually something that should be reviewed by, after this pandemic is over, I would suggest, quite carefully. This Omicron variant has again demonstrated that viruses know no borders, so that as soon as you found something out about a new variant or indeed the next pathogen or virus, it's probably cross borders. So borders are there to slow down or delay and buy time. So how do we achieve best practices in that area? I think it still remains to be properly examined once we got further into the pandemic, because I think I was trying to reflect on this as I was finishing up the report, how the way that we see things now could be very different than how we see things at the end of the pandemic. And avoiding making sort of early premature assessments or determinations is very important. But the border health, travel health strategies must be an area of examination afterwards. Thank you.
Prochaine question.
Next question.
The next question is from David Thurton from CBC News. Please go ahead.
Hi, good afternoon, everyone. Dr. Tam, in your remarks, your prepared remarks, you said that we were not prepared to face a public health emergency of the magnitude of COVID-19. Just to my knowledge, I never heard you or Dr. New acknowledge that we weren't prepared. Is this the first time you're acknowledging this? Is it correct to say that this is the first time that you're acknowledging this?
I don't think so. I mean, I think that it is such a huge public health crisis that we have not seen for a century, that I don't think anyone in the world is that prepared. Most countries are not prepared, and most public health system was not entirely prepared. And we always have to flexibly scale up very fast, and we did. We learned rapidly along the way and flexibly adapted. So one might want to ask a sort of a rhetorical question, which is, can you ever be prepared entirely for such a huge undertaking? Possibly not, but you need to set up the system and the scale up and the surge that is needed in order to be better prepared for the next round. So I think, I believe there was another measurement from the Global Health Security Index, which is an indicator of how countries are not prepared for public health crises. Canada scored relatively high, but no country scored really high. And some of these indicators or indices don't tell you a lot about the political will or the trust and social cohesion in the population. What I would say is that Canada, if you reviewed Canada's response over time and did assessments during this pandemic in different time periods, you might come to different conclusions. Right now, I think Canada's done relatively well compared to other countries, but we need to continuously improve. and prepare better for the next time.
Okay, thank you for that, Dr. Tam. I just want to switch gears here. Yesterday, the Governor General canceled her trip to the Grey Cup, and because of COVID concerns. With the growth of Omicron, should others be following her lead? Is that the right decision to be making?
I think that is such a rapidly evolving situation. I would advocate for a more precautionary approach right now. So I think the Governor General did show great leadership. It may depend on your individual risk assessment as well. So I think seniors and others need to, of course, as usual, protect themselves even more in a more vigilant way, but everybody needs to take a more precautionary approach. What we see is that this variant has the propensity to spread very rapidly, causing super spreading events in many settings, including sports events, sports matches in different countries, workplace parties, schools. So I think there's a risk. And given the projections that we put out there on Friday, I think provinces will soon come out with some further measures given the epidemiologic situation. And I am not as versed with sports as Dr. New, but I believe this was in Hamilton because I asked about that last night. And Ontario is experiencing an upsurge of Omicron variants, so I do think that prudence is very much advised.
Prochaine question.
Next question.
The next question is from Laura Osman from the Canadian Press. Please go ahead.
Hi, doctors. Thanks for taking our questions today. When you were responding to my colleague Ryan's question, you were talking a lot about sort of after the pandemic. And I think with the rise of Omicron and the modeling that you put out on Friday, and given the high transmissibility potential of this variant, people are wondering, how do we get to a post-pandemic world? Certainly it doesn't seem like the eradication of COVID is what's going to get us there. So could you sort of explain to people how we might reach an end to this?
That's a great question. And I think this virus keeps teaching us lots of different things. And I think one thing in public health that we all learn is humility in front of a formidable foe like this virus. So we're learning every day. What I always say is that every pandemic runs its course. And you can't eradicate this virus, not in any time soon, but perhaps it will remain in the human population for many, many years to come. So what we're looking at is a transition from this sort of urgent crisis response state to one where the virus is more predictable. The seasonality perhaps is more predictable. So these cycles are more predictable over time. And I certainly messaged before that this winter is going to be a bit of a bumpy ride. And sure enough, we've now got one of those bumps. And Delta was already a bump in our bumpy ride towards spring. There will be other variants potentially. So we do need to essentially be able to ride out these bumps, knowing that we have vaccines, we have testing, we have public health measures, we have treatments, some new ones to come. With all of that, I think all of this points towards still an optimistic outlook in the next year. But of course, I reserve the judgment because we have to reassess the situation on an ongoing basis. But I think the population is getting more and more immune, particularly from vaccinations. And we're looking towards the vaccines offering good protection against severe outcomes. When we reach those points of more predictability, that's when the pandemic will become what we call an endemic state with more predictability. And then we can be better prepared and take all of the tools that we have and apply it and to protect our population.
That's encouraging. Thank you. I also wanted to ask you about a sort of somber milestone that we're looking to reach this week or next, which is 30,000 Canadian deaths associated with COVID-19. Obviously, the people who have been most impacted by COVID has shifted over the course of the pandemic. I was wondering if you could explain now who appears to be at the greatest risk of dying as a result of this virus currently.
Mm-hmm. Yeah, so in my report, I do go over the pandemic up to the end of the third wave and the beginning of the fourth, and showing how things have shifted over time. At the beginning, of course, long-term care, both the residents and the health workers, particularly personal support workers and elders in the community were the most impacted, and they're still at the highest risk of severe outcomes. When the vaccines arrived 1 year ago, we saw a dramatic shift in the epidemiology with a drop, particularly in our mortality, which is great news, and that's been sustained. So despite the fact that we have this very tragic number of 30,000 deaths, the trajectory was that this dropped dramatically after the vaccines came into effect and continues to be at sustained at a lower level. Then we looked at our hospitalizations and ICU emissions, and that shifted as well. So when vaccines came into place for the older populations and the high risk, we saw increase in hospitalizations in those that are a little bit younger in the adult population, the 30 to 49-year-olds, for example. And they ended up in hospitals and ICUs because they had the highest rate of contacts. The public health measures were relaxed at that time. So we saw a surge together with the emergence of more transmissible and more virulent variants, including the Alpha variant, and then a whole suite of other Greek letters, and of course the Delta variant. Then the latest temperature check, you've seen the epi and modeling presentation, is that during this very last wave, kids became at the highest level of case counts. They still had very little serious outcomes. So we're certainly hoping that the vaccination campaign and now spreading to the younger age groups will give us a really important layer of protection. And it still will against even the Omicron variant, even though we're still learning about it. So that shift to the school age kids and most outbreaks occurring in schools is very, very different from what we were seeing last year. And milder illness, of course, outcomes in those kids. And so I think we've come a long way, and we need to just keep going and just to reinforce our protection while we're learning more about the latest variant.
Opérateur, il reste combien de personnes sur les lignes?
Operator, how many people are still on the
Nous
line?
avons 3 autres questions.
We have 3 further questions.
Okay, so we have 3 more people on the line and about 8 minutes left. So if we can just keep the answers, the questions and the answers short, it would be great. Prochaine question.
The next question is from Anna Thibodeau from CBC National News. Please go ahead.
Oh, hi. Thank you, Doctor, for taking our questions. One of the things you mentioned is that this Omicron variant is more transmissible because of waning immunity. So you keep pushing for boosters. Should expediting boosters before the holiday break happen in light of Omicron?
I think that as per the National Advisory Committee on Immunization, those over 80, the higher risk healthcare workers, Indigenous peoples on and off their communities, such as First Nations communities, are very, very important. And so I think every effort should be made to get the booster shot into arms. I just want to maybe clarify your question just to make sure I'm really clear. So this Omicron variant has a very high spread potential, and that could be a combination of the inherent nature of the virus in terms of increased transmissibility. We're still trying to work that one out, learning from other countries, but it has high spread potential, maybe from a combination of the transmissibility of the virus and the drop in immunity, whether they be from previous infection or from vaccinations. But the good news is that, at least from the antibody level perspective, that will get boosted with the boosted dose. And so that is the effort. And I've talked to other chief medical officers about it, and I think they all know that this is the area of focus in addition to the pediatric vaccines.
My second question is, I saw a specialist out there say today that Omicron wasn't present on November 20th, but this will be the dominant strain by later this week in Ontario and replace the Delta variant by Christmas. Do you agree with that statement?
I think data is emerging out of Ontario in particular, not quite so much from the other jurisdictions yet, but they may follow. My colleague, Dr. Kieran Moore in Ontario, has indicated to me that there's increasing replacement of the Delta variant by the Omicron variant. And what you quoted, I think, is along the lines of the Ontario Science Table and Dr. Moore. So I do think that what they're saying is going to be true for different areas of Canada as well, as it has been for some of the European countries. But what that actually means remains to be seen. So right now, we just need to layer on those protections, get the boosters, decrease your contacts, and as we learn more.
Prochaine question.
The next question is from Diana Drong from the Canadian Medical Association Journal. Please go ahead.
Hi, thank you, doctors. Contact tracing has been inconsistent across Canada. Suffice to say, we were unprepared for the scale of the pandemic and we weren't able to mobilize for contact tracing. With community spread and Omicron here now, we're starting to see public health units struggle with contact tracing and losing track of the virus in terms of managing its spread. So is contact tracing still necessary going forward, or is it not important?
That's a really key question and a concept in public health. So at the beginning, you will be able to identify cases because you don't have that many of them. And then the contacts from those cases are relatively easy to track. Once you get us to a certain point, you really can't do that very easily. We have had surge capacity provided to provinces, including leveraging Statistics Canada and their cadre of expertise in contacting individuals. But that won't be enough when the virus is rapidly spreading, which is why then broader public health messaging is very important. And so that the broader messaging about vaccinations, but also reducing contacts then becomes more important. Public health units are asking cases to let their contacts know. But the easiest way to reduce the need for contact tracing is just simply reducing the number of your contacts.
Thank you. And just a quick follow-up. So how does Canada change that trajectory to get things under control and make sure that the contact tracing systems aren't overwhelmed?
Yes, so as with other waves of the pandemic, rapid action in reducing contact is the key to preventing that very sharp and acute peak. Vaccinations forms a foundational layer so that the virus may not spread quite as quickly and certainly protects us against severe outcomes. But it won't be enough to prevent an acute peak that can overwhelm your healthcare system. So the public health measures are very important. And by reducing your contacts, it actually then makes it easier for any kind of important contact tracing. I think where contact tracing might be important in certain high-risk settings, for example. But I think as the virus escalates rapidly, we know how to work together to flatten that curve. And we need to do that pretty rapidly starting now.
Prochaine question.
La prochaine question de Catherine Lévesque de la presse canadienne. La parole est à vous.
Oui, merci de me redonner l'occasion de poser une autre question. Juste très rapidement, je voulais avoir une précision. Est-ce que la transmission communautaire d'Omicron, elle est, selon vous, juste en Ontario actuellement ou elle est dans l'ensemble du pays? Et je voulais aussi revenir sur la modélisation de vendredi dernier. C'était inscrit qu'on pourrait se rendre jusqu'à 26 600 cas d'Omicron depuis la mi-janvier. Je me demandais si dans les circonstances actuelles, c'était un scénario là, qui pouvait se réaliser.
Merci pour la question. Selon moi, le variant Omicron est partout dans la province au Canada. Maintenant, ce n'est pas juste en Ontario, mais peut-être la transmission un peu plus faible dans les autres provinces, mais c'est une question de temps. Dans les prochains jours, on va avoir beaucoup plus de cas. Notre modélisation, c'est un scénario. Ce n'est pas nécessairement le vrai chiffre. On peut, c'est dans notre futur, dans notre main, comme Dr. New a déjà dit. On peut influencer la trajectoire en utilisant la couche de protection, et réduire notre contact, et augmenter notre niveau de vaccination, tout incluant les doses de rappel.
C'est Dr. New. Je peux seulement signaler que je suis complètement d'accord avec Dr. Tam et on voit partout dans le pays, même ici au Québec, la ville de Montréal, on a déjà signalé quelques cas peut-être non liés ou on ne trouve pas lien avec les voyages à l'étranger. Donc, je pense que vraiment les indications que la transmission communautaire, c'est un peu partout dans le pays. Et on verra dans les prochains jours et semaines, mais je pense que oui, selon la modélisation, c'est possible. On va atteindre des nombres de cas beaucoup plus élevés, mais c'est aussi, on peut faire quelque chose. Ce n'est pas comme déterminé, c'est vraiment qu'est-ce qu'on fait comme l'ensemble du pays avec les actions individuelles de tout le monde. Et je pense que Dr. Tam et moi, on a déjà constaté, même avec les rassemblements en famille pour les fêtes, je pense qu'il faut réviser parce que moi, je pense vendredi, j'ai dit, OK, peut-être c'est pas une bonne idée d'avoir les rassemblements, peut-être 20 personnes, peut-être c'est 10 personnes, mais avec le variant Omicron, peut-être qu'il faut réviser encore. Donc, c'est quelque chose à suivre au fur et à mesure et je pense qu'aussi les autorités de santé publique à travers les pays suivent étroitement ce qui se passe actuellement dans leur juridiction avec la situation épidémiologique. Merci.
Opérateur, est-ce qu'il nous reste quelqu'un sur la ligne?
Nous n'avons plus de questions pour le moment. There are no further questions at this time.
Alors, c'est ce qui met fin à cette conférence de presse. Merci tout le monde.
Merci. Bye.
Thank you.